Zainab is a young mother of one who lives in Chanchaga local government area in Niger State, Nigeria. Zainab's first experience of pregnancy is one she will likely never forget. While in labor, she was asked to get water and other items for her delivery before she could be attended to by the midwife on duty. Sadly, Zainab eventually delivered her first baby while on the way to fetch water.
I was pregnant. The day I supposed to give birth, I experienced a lot that I'll never forget about. When my pregnancy was about 9 months, they gave me list, detergent, Dettol, like this hypo, so I was able to bring those things. So the day I was supposed to give birth, I went to the hospital, they checked me, the nurses said my gloves is finished and they have no water. I was feeling somehow vomiting, I want to piss, I feel like to poo-poo, they said it's about labor. I went to the toilet, there was no water, the toilet was messed up with blood, piss, shit, so I couldn't even do anything. I was vomiting, no water to rinse my mouth. I'm feeling to poo-poo, no water to wash myself. There was no water at all. I was told to go back home to bring water and the women that can help me. I was afraid. I was really afraid because it was my first time giving birth. On my way going back home to bring my neighbor who will bring water and the other old woman who will bring the items and the wrapper that I will give birth on, and the woman who will pack my wrapper and wash. On my way, labor started. Before I even enter house, compound, I just give birth. My neighbors helped me.
Luckily, she and the baby survived the ordeal, but it left an indelible impression on Zainab. Until today, she is afraid of getting pregnant again. Zainab represents over 30,000 women in the state who responded to the What Women Want campaign launched by the White Ribbon Alliance, which asked women what their most important needs for reproductive health were. Water, sanitation, and hygiene were the #1 demands of women of reproductive age in Niger State.
What I want the government to do for us is to help us with clean water. If there is water, everything will be good. The person that is taking care of the place, when the person sweep there, he will wash there. We need Dettol to make the place neat. At least when you enter the toilet, you'll be okay. In the primary health care, we need water. That's what I want.
Water, sanitation and hygiene, WASH, are important for delivering quality reproductive health services and preventing and controlling infections in healthcare facilities.
Honestly speaking, one of our greatest challenges in this health facility is water issue. We don't have water at all in this health facility. If you look at our health facility, there is a point there where borehole has been dug. And if you look at my back of my office, there is a tank there. But since I came in, there was nothing like maybe overhead tank that water is running up to this moment I'm talking to you. So water is our #1 priority in this health facility. We have so many experiences, especially once we are conducting delivery at night and there is no water. You can imagine what will it look like. Because there was a day I have to, like 1:30, call our health attendant that lives around this area that she should help us with 1 bucket of water because we had a delivery. You can imagine, she had to risk her life to bring just a bowl. You know, without water, we cannot have a quality service rendered to the women in this society.
WASH for healthcare facilities includes the availability of water, good sanitation, availability of toilets, and proper waste management systems. Poor WASH conditions in health facilities contribute to high levels of maternal and infant mortality and also reduce the demand for deliveries in health facilities. Many women opting to deliver at home or in private hospitals where the WASH conditions are more acceptable.
We don't have running water here, we don't have pipe water in this clinic. During antenatal visit, the moment women came here more than 10 and they are using that toilet without water, you see the clinic can't even people to enter because of a smell.
The sad reality is that many primary healthcare centers in Niger State do not have adequate WASH facilities. Recent data shows that only 3 out of 10 health facilities in the state have the WHO standard requirement for water availability and use in health facilities. Similarly, just 3 out of 10 facilities meet the WHO requirements for functional toilets in health facilities, while 2 out of 10 primary healthcare facilities met the requirement for sanitation and quality hand washing stations. In terms of waste management, only 1 out of 10 had waste dumping systems, protective equipment for janitorial staff, standard procedures for waste management for staff, and functional dustbins.
That yesterday, if not because our house is nearby here, I wouldn't have known how I would do. So I have to send a child to go back home and fetch me water that I will use here.
So what do women and girls in Niger need? Zainab and other women like her with similar experiences are all asking the government to act urgently and save their lives by installing hand washing facilities and at least 1 or more fully functioning toilets within each of the 274 focal primary health centers in Niger State. Secondly, they need their government to review the water policy to ensure improved wash services across primary healthcare centers in Niger State. Thirdly, they need their government to coordinate and implement a wash roadmap that ensures that no PHC is left behind. And finally, they need the efforts of well-meaning individuals and organizations to support communities and complement government efforts by donating wash facilities for primary healthcare centers across the 274 wards in Niger State.